I'm Dr. Nasser. I'm the medical director of the Acute Rehabilitation Unit at Palmdale Regional Medical Center. So we have an acute rehabilitation department. We have some very specialized equipment here, and we work as a team. Patients who come to acute rehabilitation have active medical problems that need supervision, but also require multiple therapies like physical therapy or occupational therapy or speech therapy, and oftentimes all of those therapies in combined. And it's a very special unit because we're unique. There isn't a unit like this in the Antelope Valley other than what we have. No one has the equipment that we have. We've really gone to great lengths to get some very specialized equipment for these problems, for these disorders, and to help these people.
We have a very magical place here. It's very different. We want to replicate as much as we can those activities that you'll be doing so that you're successful when you go home. We have a simulated car, and so that's something that the patients can do. We don't have to take them out in the rain or the heat or the wind. We do have a vector, which is our device. Yeah.
We have the virtual reality
We have the bits,
trainer.
Our virtual reality trainer.
Yeah. We have the new Alter G. Yeah, the Alter G and the Vector basically de-weight a person, and they're allowed to walk on their legs without the weight of their body. So if a person is partially weak on their legs, it's really cool. They have a harness and everything, and the the Alter G, you can actually run on a treadmill without the weight being on your legs. So it's cool, and it's great in this setting, but it's also great in the outpatient setting for people who have sports injuries and back pain and things like that.
Especially for some of our younger patients. We bring patients all ages, you know, they're in their 20s, they're in their 30s, they're in their 90s. So an Alter G would be good for someone who's athletic.
Absolutely.
You know, that maybe had a ankle fracture, and, and we can get that weight off of their leg. One of the biggest fear is for the patient is, what am I going to do with my new inability to do a certain task? Something so minimal like going to the bathroom is so important, and that's so important for the patient and the family, the caregiver, to be there for and learn how to do it with this, possibly with this new disability this patient's going to have. We encourage family education. We encourage being here with your loved one, because it's going to bring out the most out of the patient in order to be successful.
Yeah, we love having the families come and actually participate in therapy. You know, when the patients go home, they're going home with mom, dad, wife, husband, or whatever it's going to be. The more involved that the families are here with when therapies come by or what the nurses are doing, the better. And again, I think that also makes it something that's very unique to our unit is the family involvement. I mean, Nestor meets with all the families, we identify different things, and if we identify a family or a situation where patients really need extra care, then we will all meet with that family, with the family members. Education is really, really big, especially in healthcare. And the more we educate these families on how to care for their loved one at home and what to look for as a potential problem, the more successful that they're going to be, when they get home and when they're in that environment. We even have an apartment. We have a little suite on the side here, a makeshift apartment with a bed and a couch that's completely different than a hospital room, and patients can stay the night in there with their families. They can practice getting in and out of a normal bed. They can practice getting in and out of a normal chair. We have a kitchen where they practice making meals and doing things. And that also lends to a really great community that we have in our rehab unit. We have patients who will make meals for the other patients. We do a lot of community activities here with the patients, whether it's games or different things with occupational therapy. So, we're creating kind of a home environment for them. And again, that's what acute rehabilitation really is, a transition to home.